Hello and welcome to the Wellness Connection. I'm your host, Fiona Kane. Today I'm going to be doing a pure health episode, so a bit of a switch up. I'm talking actually about heart disease today, but in particular I'm actually talking about heart disease in women because that seems to be a bit more silent. They haven't sort of studied that as much, and we're only just sort of realizing in the last few years that it can look quite different in women than it can to men. So in Australia, more men than women have heart disease, but women's heart disease is more likely to be unrecognised. It's also a leading cause of illness and death, with about 54 women having an acute heart event, such as a heart attack, every day in Australia. So this is just in Australia, but this would be, I'm sure, happening all around the world. I'm sure there's a lot more in the US because they've got a much bigger population. So, women can experience heart symptoms even with only minor heart artery disease. They are also more likely than men to have problems. Let me just see. I'm just still checking my notes. To have problems in the small arteries, which can lead to blockages of those vessels. So, risk factors for women in regards to heart disease. And I'm going to talk about some signs. I'm going to talk about 8 signs. So, eight signs of a heart attack in women. So, hang on for a moment. I will be talking about that shortly because I think it's really important to actually understand what that might look like. But I will just let you know that the risk factors. Look, for women, we have a lesser risk until we go through menopause. But once we go through menopause, we're at just, I think it almost equals out to the risk of men. And so the earlier you go through menopause, the more risk you are. So just have an awareness about that. Once you go through menopause, you can't assume that you're safe. Once we don't have those protective hormones, we are at just as high risk of heart issues as men, or very close to it. So the risk factors, early menopause, which would be before 40. But even just once you've been through menopause, it's a risk factor. So polycystic ovarian syndrome, and that's probably because it's closely related to insulin resistance, which is sort of related to diabetes, and that is certainly a risk for heart disease. But also includes, and actually this is the same thing. So pregnancy complications, including preeclampsia and gestational diabetes, and or having a low birth weight baby. Now, the preeclampsia and gestational diabetes, that's because they are about blood pressure and diabetes, blood sugar regulation, and both of those things are very interconnected with heart disease. So that's why that they would be in there. So being on the oral contraceptive pill, I know it certainly increases your risk of stroke, which I didn't realize at the time when I had my strokes when I was younger and I was on the pill. Anyway, and then starting your period at a young age, so having menarche at an early age, anemia, especially during pregnancy, and depression. And so all of these things are risk factors for heart disease in women. And I've talked before about staving off this and diet and all of that kind of stuff. Just a very quick version of that is, avoid smoking, manage your weight, keep a healthy weight, eat a balanced diet. I've talked about that in a lot of detail in other episodes. Do regular physical activity, of course. Limit how much alcohol you drink. Find ways to relax and manage stress. I've talked about that in many different ways in many episodes, and manage any health conditions like diabetes or blood pressure, those sorts of things. So what I'm going to do now is I'm going to just go through these 8 signs of a heart attack in women, because it is really important to understand what this might look like. So the first one is chest pain, which most of us are aware of the chest pain thing. We're aware of that when we know that from watching TV or things we've heard about, things we've seen. Chest pain, apparently in men and women, it's the most common symptom of a heart attack. But heart attack pain in women often feels more like chest tightness, pressure, or discomfort. So women who are having a heart attack may have no chest discomfort at all. That's why it's important to take note of the other warning signs. So women might not have the chest pain at all, but if they do, it actually might be more of a discomfort than it is like a full-on chest pain. So women, that's why we need to look into this differently. Look, and a lot of these symptoms could be symptoms of other things. But that's why you kind of have a good idea of what's going on in your body and you talk to your doctor and you figure it out. Or if you're unsure, just go and get medical help, because it's better to be sure and better to know what's going on. I know for myself, I was having chest pains because I have a lot of muscular issues, but I had like an inflammation of the muscles in between my ribs, and that was causing me a lot of chest, like sharp chest pains. But it wasn't my heart; it was my muscles. So I had to understand that, and I've sort of learned what that feels like. And it's just knowing, and also people who suffer from reflux, again, that can be similar, and so can anxiety. So sometimes it's learning to know what the difference is, and if you don't know the difference, or if you're not sure, go get medical help, because don't assume that it's just anxiety or whatever, especially when you know you're in a higher risk group. So other signs can be, so number two, so number one was chest pain, or it could just be discomfort. But number two is pain in the upper body. So one of the warning signs for women's heart disease is pain or discomfort in the upper back, neck, jaw, or arms. This pain may start gradually, suddenly, or come and go. And the other thing that I've heard, there's a lady who does great CPR courses in my area, and the last course I did with her, she explained that it's not unusual for women to have like that. Their clothes start feeling tight around their neck, or like they're feeling on their neck, and they're uncomfortable with things on their neck. So they're unbuttoning things, or they're taking off a scarf, or they just get generally feel uncomfortable around the upper chest and neck area, where they feel very restricted. So that could also be a sign, which you wouldn't think of that as being a sign, but apparently that can absolutely be a sign, particularly for women. So that's number two, pain in the upper body, and that kind of like discomfort around the neck area. And it might not even be pain. It just might be you don't want things there, or you just generally don't just feel uncomfortable there. So number three is unexplained or unusual fatigue. And that, again, that can be challenging for women because we often have a lot of reasons why we have fatigue, but it's unexplained or unusual. So something different for you, I suppose. So fatigue that you cannot explain is another sign of heart attack. So you might feel exhausted for no apparent reason, way more tired than usual doing your regular sports or activities. Some women have unusual fatigue in the weeks before a heart attack. So you're just feeling more tired than usual, and there's no explanation for it. Number four is shortness of breath. This can be one of the first signs of heart disease in women. So see your GP if you start to huff and puff doing things that didn't make you breathless before. If you feel breathless for no reason, that's like you're not even exerting yourself, you're just sitting around and you're feeling breathless. And if you feel short of breath when you lie down flat, so you lay down and then suddenly you can't get a breath, they are all reasons to go and see your GP and figure out what's going on there. So anything to do with shortness of breath, we definitely need to rule out any heart issues there. Number five is lightheadedness or dizziness, which is a challenging one for women, or it's a challenging one for me because I've had a lot of those symptoms throughout my life, and they can relate to your blood pressure being low, they can relate to your blood pressure being high. So low is less of an issue and more kind of just worry about not falling over, but high can be quite an issue. And in my experience, they can feel quite similar because I've experienced a lot of low blood pressure, but I've also experienced some high blood pressure. And I find that it's quite a similar feeling of dizziness. So you don't always know, which is why, and get up, like you get a blood pressure machine, check your blood pressure, because I find that, especially for me, I've always had low blood pressure, so I just always assume I have low blood pressure when I have those symptoms. But recently, when I was having a headache, it turned out it was high blood pressure I was having at the time. So, I didn't know that. I was always, I always have low blood pressure. It's always low, and I felt the same. So just be aware of that too, especially for women, because I've had a long history of, low iron and kind of dizziness and fainting and low blood pressure my whole life. So I'm kind of just like, oh, well, I have low blood pressure, but I didn't on this particular occasion. So It's good to know just because you all have always had low blood pressure, it doesn't mean that's what's going on right now. So it's good to have, especially once you're of a certain age, it's good to have a blood pressure machine at home and or go and see a GP, because it might not be low just because it always has been, and it might feel the same. It might not be low. So just be aware of that, because I was quite surprised by that myself. So lightheadedness or dizzy. So women are more likely to feel faint, lightheaded, or dizzy when they are having a heart attack. The next one is weakness. Number 6 is weakness. So feeling weak, unsteady, or shaky is one of the most common symptoms of a heart attack in women. So it may be accompanied by other symptoms such as anxiety, dizziness, lightheadedness, and fainting. And this is where it can get really challenging for people who have anxiety attacks, because obviously it looks exactly the same. In my experience in hospitals, they say, if you're not sure, go and find out, because you can't, no one's going to be angry at you if it happens to be an anxiety attack. It is what it is, and just get checked out. It's best to be safe than sorry, especially once you know you're in a certain category. When you're 25, might not be as big an issue, but when you're 45 and 55, you've got to clarify what's going on for you. So another one here that can be confusing for people would be number 7. It's gut symptoms. So some women experience gut symptoms before having a heart attack. So it includes pain and pressure in the stomach, and sort of know that your stomach's kind of like, it's kind of up high in the middle. So essentially just below, below your breasts, but just below your breastbone there. So just below your breasts anyway. So right at the top of the abdomen, that's like where your stomach sits. It's kind of there. And so if you are having that pain or pressure in the stomach, if you're having nausea, indigestion, vomiting, all of those can be signs that you're starting to have, that you're going to have a heart attack. And they are actually, they're quite common symptoms if you have a stroke as well. So when I had my stroke, my first one, no, it was my first one. It was my second one. When I had my second stroke, which was much bigger than the first one for me, I experienced it much more. The other one, I didn't even realize I'd had it. But the second time I had one, I absolutely did know I had it. And one of the reasons I knew that is because I vomited for 3 days. And so vomiting is whenever you have a space occupying lesion in your head, which is any type of bleed or tumor or clot or something, when you have that going on inside of your head, that one of the big symptoms of that is vomiting, and like nausea and vomiting. And so just be aware of that. And I think sometimes too, when our body's just dealing with some bigger issues, that's what happens. Because when I think back to around the time that I would have had that first stroke, I didn't know I'd had it at the time, but I was having a lot of migraines, and I had my strokes during migraines. And I was drinking a lot of alcohol at the time. And I found that I went from being able to drink a lot to not being able to drink at all. So I would have one drink and I would be violently ill for 3 days. And that was a sudden change in me that hadn't happened before. I think I only ever drank one more time after that, and just it wasn't worth it, because when you're violently ill within 20 minutes of having a drink and then you're violently ill for 3 days, you're not attracted to alcohol anymore. So I was 23 when I stopped drinking for that reason. And, I think it's like when there's trauma going on in your body, when your body's dealing with things like strokes and heart attacks and things like that, the last thing it can deal with is your digestion. So you're going to have a lot of those issues. And so, that's probably, there's so much pressure on my body dealing with like all the emergency things, that digestion was the last thing on its mind. So just be aware that that can absolutely be symptoms in regards to stroke and in regards to heart attack. The gut symptoms. So if there's a sudden change and you're having gut symptoms. So that was number 7. Number 8 is sweating. So breaking out in a sweat for no apparent reason is another common sign of heart attack in women. A cold, clammy sensation could also suggest heart issues. So, if you're having one of those, you might kind of, depending on how different it is for you, whatever you might be thinking about. But, if you're starting to have a few of those issues, there's a good chance you're having a heart attack. And of course, if you're not sure, get medical help. It's best to get medical help and clarify what's happening for you than it is to end up sorry. I'm going to just quickly go over those again just to clarify what they were. So, you know, um, remember that they can be more subtle. These signs can be more subtle in women, and you know, women can often have we experience symptoms that aren't triggered by physical activity, and are more likely to have symptoms in the weeks leading up to heart attacks. So we'll get these symptoms in the weeks leading up to the heart attack. And so here's the 8 possible signs. I'm just going to go over them once more, very briefly, just so that you remember this. And actually, this is an important episode to share with your friends. And it's useful for men as well, because a lot of them are very similar, but it's just kind of really narrowing in on the fact that it can be quite different in women, and we need to have this awareness of our risk, okay? So number 1 was chest pain, but remember, in women it might just feel like discomfort or tightness or pressure. So, but also remember, in women that they don't always get chest pain when they're having a heart attack. So you might still be having a heart attack even if you're not having chest pain, if you're having some of the other symptoms. So keep that in mind. Number 1, chest pain. Number 2, pain in the upper body. So it could be upper back, neck, jaw, arms, and it might be gradual or it might suddenly come on. And remember that thing about women just being uncomfortable around their neck, not wanting things around their neck. If you're suddenly feeling that way, then that could be a sign that you're having a heart attack as well. Number 3 was unexplained or unusual fatigue. So anything that's new, unexplained, particularly if it's on when you lie down or when you're not doing anything, or something that you normally do. You normally walk to the car after this, or on the way to the train station or whatever. Suddenly you get puffed trying to do that. So Number 4 is shortness of breath, and it's the same sort of thing again, as far as if you suddenly get puffed doing things, if you're feeling breathless for no reason, all of that sort of stuff. So the fatigue and the shortness of breath, these all sort of tie into each other. Number 5 is a lightheadedness or dizziness. So we can have that in association with some of these other symptoms in relation to a heart attack. Weakness, so feeling weak or unsteady or shaky, they're common symptoms in women, and they may be accompanied by things like anxiety, dizziness, fainting. Gut symptoms, so I talked about before, if you're having if you're vomiting, pain in the stomach, indigestion, nausea, and again, always consider this as like if it's something new or if it's something that's building up or getting worse. It's always worth getting this stuff checked out. And number 8 was sweating. So it could be breaking out for a sweat for no apparent reason, and or being cold and clammy. Both of those could be signs that you're having a heart attack. So I think it is important that we understand what these signs and symptoms may be, and understand, particularly for us women, that once we've gone through menopause, or we've gone through menopause, the hormones that protect us from heart disease, unfortunately, are no longer there in that amount, and we do have ended up at that stage having the same risk or very similar risk to men. So I hope that that's useful. Please remember, no matter what, if you're not sure, don't use Dr. Google. Use your common sense and get help from your doctors. And the amount of people, like, they ring their GP to get permission from their GP to go to go, and for those of you who are overseas, your GP, general practitioner, in Australia we call them GP. So your GP is your general doctor, that's the main doctor that you see here, and then they refer you to all of the other places and all of the specialists and things. So GPs is just sort of just general doctors who know a little bit about all the things, and then they refer us on for other things. But the amount of people who go to a GP practice in Australia, or ring a GP practice in Australia if they're having when they're having chest pains, okay, it's better than not getting help at all, but I would advise, if you're concerned and if you think that you might be having a heart attack, go to the emergency or ring an ambulance, because it's the time that you might waste going to your GP. I mean, your GP, when you get there, will ring the ambulance if they think there's something going on. But anyway, I don't think ringing a GP is probably the first option for me. I think I'd be ringing the ambulance if I thought I was having a heart attack, but GP is better than nothing, I suppose. Anyway, I hope you find that useful. Please share this. It's really important information for people, particularly women. And please like, subscribe, rate, review, and all of those things. And continue. We're going to continue having important conversations about things that matter, whether that be mental health, physical health, our society and our culture. All of those things, they're all important. And I will continue to talk about those things. Thanks, and I'll talk to you again later. Thank you. Have a good week. Bye.